use this in college, you're going to get smarter. It's not what they say, but it's probably true. So by the end of this episode, you're going to think I'm a salesperson for infrared, and I'm not. I really just want you to improve your health. But just as a disclaimer, I do actually have one of these infrared LED units. I got it from Scott Nelson. I talked to him on the phone. He's the co-founder of Juve, and he's a friend of a friend. We talked for a while, and I'm going to use the infrared on stem cells, on adipose fat-derived stem cells from liposuction from human patients, and kind of reprogram the stem cells, hopefully inject them back into joints. I'll keep you posted. We'll talk more about that next time, but I don't make any money from these things, but I really appreciate the benefits from a scientific perspective. Today, let's talk about the brain. Start with 2008. I've got 3 papers. This one's from 2008, the next one's 2011 or 13, and then the next one is 2017. So from order of, historical to new. Journal of Neuroscience here. This paper is called Neuroprotective Effects. Neuroprotective, brain protection. Neuroprotective effects of near-infrared light in an in vivo model of mitochondrial optic neuropathy. Optic nerve, your nerve coming from your eye going into your brain. How protective is infrared? Well, near infrared, they start off by saying, promotes a wide range of biological effects. This is so true. We're going to talk about that wide range next time real specifically. And really, again, it kind of imitates or simulates exercise. These effects include enhancing energy production, it's kind of important, preventing cell death, and a lot of other things we've talked about. This paper is the first report of an in vivo neuroprotective effects of near-infrared light. So what do? They used rotenone. It's an inhibitor of mitochondria, kind of is as bad as it sounds, to induce basically decreased visual function, kind of this. It wrecks this nerve, wrecks your brain function. And they had these rats running through mazes. And basically they found that, of course, their maze time decreases, but as they use the infrared therapy on these rats, they were able to kind of recover even with this nasty drug. It's not really a drug, it's more used in research. But, it's a drug. Nerve fiber layer thickness, ganglion. They did all kinds of measurements, all kinds of good stuff. They even found that this near infrared was dose responsive. So as they gave more doses, they found more and more and more improvements. What were the doses? Well, they had the thing 3.8 centimeters above the mouse heads. So really, really close. And then for 30 minutes. That's how long these sessions were that they were giving the mice. The wavelength was between 630 and 1,000 nanometers, in case you care. Let's move on to the next paper. 2013, the Journal of Neuroscience. Let's get specific on Alzheimer's. So yeah, that's neuroprotective. It's ganglions. It's, the optic nerve. Let's talk Alzheimer's. This paper in the Journal of Neuroscience. Low-level laser therapy. Again, that means infrared. Rescues dendrite atrophy. Dendrite, those are those protrusions from brain cells, those long branches. It rescues atrophy of those dendrites, the kind of sluggishness, via upregulating BDNF. What is BDNF? Brain-derived neurotrophic factor. I used to study Alzheimer's disease. I did 2 or 3 years of Alzheimer's research in Boston. We used to call BDNF miracle grow for the brain. Because if you have neuron cells, brain cells growing in a dish, and you put this BDNF protein on those cells, it causes them to grow like crazy. They grow new shoots and leaves and branches. It looks like a Miracle Grow commercial. That's BDNF. Low level, laser therapy, infrared, up regulates Miracle Grow for the brain. Implications for Alzheimer's disease. That's just the title. Get a little carried away. So what do they say? Down regulation of brain-derived neurotrophic factor, BDNF, decreasing that occurs early in the progression of Alzheimer's disease. We know that. All right, that's been well established. How do you resolve that? We don't know as much. This is 2013 though. Here's one way. Let's talk about it. BDNF upregulation may contribute to rescue dendrite atrophy and cell loss in Alzheimer's disease. Guess what low-level laser therapy does? Let's look back at the title. It upregulates BDNF expression. I mean, that's pretty much all I want to show you from that paper. 2013. Again, why aren't we hearing about this? Why aren't we using this? You know, it's not like anything else is working. 2017, Journal of Neuroscience Research. Let's look at this paper. It's called Photobiomodulation. We're finally getting up to date with the terms. Photobiomodulation for traumatic brain injury and stroke. So let's extend beyond just Alzheimer's disease. This paper starts off by saying there's a notable lack of therapeutic alternatives. What's becoming a global epidemic of traumatic brain injury. Why is it an epidemic? I don't know. I don't know if it's really an epidemic, but it certainly is in the NFL. It is in the military. You know, even some of these blasts, these explosions can cause symptoms of traumatic brain injury. Soccer players, you know, hitting the ball on their skull. TBI, traumatic brain injury. So then they explain what photobiomodulation is, near-infrared, all this. We know that. Many studies, they say, in small animal models of TBI, they're injuring their brain in animals, mice, for example. They're literally dropping a specific amount of weight on their head, you know, imitating like a boxing match or something. They have found positive effects on neurological function, learning, and memory, and reduced inflammation and cell death in the brain. Photobiomodulation can help the brain repair itself by stimulating neurogenesis, upregulating BDNF synthesis, we talked about that in the last paper actually, and encouraging synaptogenesis, nerve formation, brain growth, decreasing inflammation. A lot of patterns here we've been talking about throughout the joints, throughout the skin, all these benefits. They're all kind of similar. They're all real systemic. And speaking of systemic, this paper is super interesting. I recommend you actually read this paper and look at it because they're going to distinguish here. And let's talk about it. Systemic versus just shining a light on your brain. So, but just to finish their laundry list of benefits, it increases, this is photobiomodulation, this is infrared therapy, this is holding a light, infrared light on your body or sitting in infrared sauna, increases regional cerebral blood flow, tissue oxygenation, improved memory, mood, and cognitive function. Use this in college, you're going to get smarter. It's not what they say, but it's probably true. So let's look at this. I really want to dig in a little bit more into this paper. Just bear with me. Transcranial photobiomodulation is a growing approach. Transcranial, that means they're just holding a light, an infrared light next to their head, somebody's head. Growing approach to many brain disorders, including sudden onset disorders like stroke or traumatic brain injury, like we said, and neurodegenerative disorders like Alzheimer's, like Parkinson's, dementia they list, or psychiatric disorders like depression or anxiety. This is just broad-based. Again, it's imitating sunlight. This shouldn't surprise us. It's healthy. They said that some of this research, this is a review paper, so they're talking about this paper, estimated that mean penetration depth of near-infrared light to the scalp was 23 inches, but human cadaver studies where they were holding the light on a dead human skull and measuring how the tissue penetration in the brain, they found 40 to 50 millimeter penetration. That's about 2 inches of penetration. So here's where it gets really cool, and I'll end on this. Local versus systemic. So yeah, if you've got mice running around in a cage and you have an infrared light, that's kind of their whole body, right? Well, what do? These researchers, and I'll just read it here because it's hilarious. They compared the direct delivery of light to the mouse head, However, they also covered up the head with aluminum foil, so the light was delivered to the remainder of the mouse body. Can you imagine? This is a science paper. This is legit. They're wrapping mice in aluminum foil, just their heads, and letting them run around just to block that infrared. And they also found there was highly beneficial effects on brain histology with light delivered to the head, of course. But nevertheless, there was also significant, although less pronounced, benefits when the head was shielded from light with the aluminum foil wrap. Various cognitive and emotional parameters. I mean, this is so beneficial, but it's hilarious, right? So they're saying essentially, if you're shining these infrareds on your whole body, you get an improved brain. And if you shine it directly on the head, especially if it's really close, obviously depends on the power of your infrared light, really close, you get even more benefits. Something to think about, something to know. Next time, again, I'll explain a little bit more of the research I'm doing directly with photobiomodulation, especially this infrared I got from Juve. But just recognize the benefits for your brain.